This is Dr. Harris with Harris Internal Medicine. I'm here because I want to introduce you to one of my patients that I've been knowing for quite a long time. Her name is Miss Lewis, and I just want to make sure that you guys understand a little bit more about direct primary care and Harris Internal Medicine from a patient's point of view. And we've been knowing each other for at least 2009. She found me after I transferred and opened my own practice in direct primary care, Harris Internal Medicine. And I used to take care of her prior to, uh, direct primary care, my days as direct primary care. Uh, and I was in a regular practice in a patient based practice in Fayetteville. So um, I want to introduce you to Miss Lewis, and we'll go ahead and ask some questions, and she could tell you a little bit more about her experience, and then also her experience as a patient with other chronic diseases such as heart disease, because this is Heart Healthy Month, and this is the month of for Valentine's Day. We want to make sure that we're taking care of our hearts, making sure that we are getting checked for coronary artery disease or heart disease. So I want you guys to, get a little bit more information about that. So with no further ado, this is Miss Lewis. Hey, Miss.
Good morning. Good morning.
Okay, so Miss Lewis, how long have you been a patient of mine?
Um, since before 2009 or
Yeah.
around 2009. Yeah, it's been a long time. It's been a long time, and I really enjoyed it. When I first met Dr. Harris, we were at another practice, as she stated, and then she left, and I was really upset. I was so disappointed. But her nurse that she had while she was there told me where she had opened up her own practice. So I had to Google her to find her. But once I found her, I kept her. So I was really excited about that. And it's great being able to reconnect with a physician that you've had for a long time, and they know you, know your body, know your ailments, know what's going on with you in your health. And I basically have her on speed dial. So if I break a nail, I call Dr. Harris. I broke a nail. She's like, oh well, you need to do this. You need to do that. I'm only kidding, but I do have her on speed dial, and if anything aches or I do call her, but I try not to. Oh, excuse me. I try not to call her after business hours too late. I might call up to about 8 o'clock.
Yeah.
Yeah, but I mean, she's great, and I really enjoy that I found her again and that I'm back in with her.
And what are some of the things that you enjoy about Harris Internal Medicine and the direct primary care model in particular?
Um, I enjoy the fact that I don't have to pay the um, what are the what is it? The deductibles.
Mhm.
Oh my gosh, the deductibles are horrible. I mean, you have to pay. Like my deductible, I think last year was like $3,500 for the family, and you had to pay the whole deductible first before the insurance actually kicked in, and that can be stressful, and that can be really inexpensive for you. So with me finding Dr. Harris again, I just have to pay a one payment each time, and it's like only what $100. It's $100 each time I come. Plus, I pay for the blood work that she does. So I usually leave out of here only paying like $115, and that's awesome. I don't have to worry about a copay before my insurance kicks in or deductibles or anything. I don't have to worry about that anymore, and I really really like that.
Cool, cool. What about the access to a doctor and the amount of time you're able to spend with me compared to when I was in practice prior to direct primary care?
I think when she when she was at the other facility, I think I may have seen her all of 5 minutes.
Yes.
So, yeah, I only had an opportunity to see her all of 5 minutes, and so you're rushing trying to ask the different questions and everything and keep her as long as possible. But now I get to see her. I get to spend time with her. I really get to spend time with her, and I don't have to rush, and I don't have to write down all my questions and make sure I ask the right question. We actually have a conversation. We actually talk like we're friends, and she's telling me, okay, well, Miss Lewis, you need to do this, you need to do this. And I'm okay, well, what about that? And we just laugh and we have a great time. And it's not like, okay, well, you're going to have to hurry up and leave because I have my next patient. She takes time with each individual person. And that's really what I enjoy because I really got to know her. But at the once she left from her other practice that she was at, and they, assign me with other doctors. I didn't get to know them either. It's like you're only there for like 5 or 10 minutes, and it's like that's not a good feeling. If you're in pain or if you have something that's wrong with you, you don't understand. You want to be able to talk to somebody who really cares instead of it feeling like you're going through an assembly line. And I didn't like that idea, but I enjoy being with Dr. Harris now. I just truly, truly love it.
Yay!
I'm so glad I found her. I'm never letting her go.
Okay, so can you tell me, with this being February, being focusing on heart disease and making sure that women, especially women, focus on the signs of heart disease and making sure that your heart is healthy, and if you do have heart disease, what are some of the things that you can tell our audience about the importance of staying on
Well, January 29th, 2009, I had a heart attack while I was at work. And I was in law enforcement. I was a detective. And I was eating healthy. I mean, I was into a lot of salads. I was working out, exercising, and everything. That's why I didn't. And then I was young. I didn't understand why I had a heart attack. And my doctor, when I went to the hospital, my doctor was saying that my arteries weren't clogged. I didn't have any issues like that. It was mainly stress. So it's been 9 years now. 9 years since my heart attack, and I try to do everything possibly right that I can to take care of myself. It's so important, and but then there's such a thing as life. Life happens, and you really can't, you can't direct the way things go because there's people do deal with a lot of stress, and I've been dealing with a lot of stress. But I've tried to. I've talked to Dr. Harris about it all the time, and she tells me different things that I need to do. And it's easy for someone to say you need to let go of certain things, or you need to just not worry about things, especially when it's your family. It's hard to to not worry about it, but you have to think about the importance of yourself, taking care of yourself, because if you're not here to if you're not here, if you pass or something, you can't help them. So you're no good to them. So it's best to take care of yourself. So I try to eat right. I try to eat smart. But with doing that, it's like you have to make sure you don't go to fast food restaurants. Make sure you're not eating a lot of sweets. Make sure you're not eating a lot of salt. And sometimes when people stress, they tend to eat a lot, and it's really hard. That's why, I'm continuously talking to Dr. Harris. What do I need to do for stress? What can I do for this? What foods should I eat? Now I'm drinking vinegar water with raw honey. I'm doing cayenne pepper. I'm doing turmeric. Yeah,
top?
turmeric. I'm trying to do a lot of things for me because I want a better me. I want to be here for a while because I have 4 children and 4 grandchildren, and my children are all grown and only one is married. But I want to see the rest get married. I want to see more grandchildren. I want to be around for that. I'm only 55 years old, and I don't want to have to worry about okay, I'm had a massive heart attack or I had a stroke. I want to do the right things. That's why I keep in touch with my doctor as much as possible. What should I do for this? What should I do for that? I mean, I've tried to find people who can help me with healthy eating and healthy cooking because you have to take care of you. Nobody is going to take care of you the way you can, not even your doctor. Whatever your doctor tells you to do, you need to do it. And if you don't understand, you need to ask more questions so that you can get a better clarification on what it is you need to do for a better you.
Awesome. Thank you so much, Miss Lewis.
You're welcome. You're welcome. Thank you for being a wonderful doctor.
All right. So I think the best thing that she said was making sure that you take care of yourself, making sure that we are your advocate as physicians. We are here to help you and advocate for you. And it's also, if you have access to us and if you have access to us as physicians, then we're better here. We're better able to help you. We're better able to advocate for you. We're better able to consult with you and give you and information that is needed to help you keep and stay healthy. And so, if anyone wants to know about the direct primary care model, or if you guys want to know about the direct primary care model or Harris Internal Medicine, please you can follow us on Facebook, or you can log on to our website at www.harrisinternalmed.com. That's www.harrisinternalmed.com, and we can give you more information about direct primary care. You guys have a great day, and thank you for listening.